The greatest wealth is health. So Virgil, the ancient Roman poet, once said. But what happens when this wealth is threatened by something as common as headaches? We've all experienced it, that pounding, throbbing sensation in our head that can range from a mild nuisance to a full-on debilitating disruption. Headaches are a universal human experience, and they're as varied as the people who suffer from them. So what exactly is a headache? Well, it's more than just a pain in your head. It's a complex neurological event that can be triggered by a multitude of factors, from stress and lack of sleep, to diet and even changes in the weather. And they're astonishingly common. Every day, millions of people around the world experience some form of headache. This brings us to the crux of our discussion: the different types of headaches, each with its unique causes and characteristics. Now you might be wondering, what types of headaches are there and what causes them? Stay tuned to find out. Headaches are not created equal. Each one has its unique characteristics and causes. First, let's talk about tension headaches. These are your everyday run-of-the-mill headaches that most of us suffer from time to time. They're often caused by stress, lack of sleep, or poor posture. Picture a tight band squeezing around your forehead. That's what a tension headache feels like. Next up, migraines. These are the heavy hitters. They can last for hours or even days, and they're often accompanied by nausea or sensitivity to light and sound. Migraines are more than just headaches. They're neurological events that can be triggered by a wide variety of factors, including certain foods, weather changes, hormonal fluctuations, and more. Then we have cluster headaches, aptly named because they occur in groups or clusters. These are intense and painful headaches that usually occur around one eye. They are relatively rare and can be triggered by alcohol, cigarettes, or even high altitudes. Sinus headaches come next. They're caused by inflammation in your sinuses, often due to an infection or allergies. These headaches are characterized by a deep and constant pain in your cheekbones, forehead, or the bridge of your nose. Lastly, we have rebound headaches. Ironically, these headaches are caused by overuse of headache medication. When the effects of your medication wear off, the headache comes back, leading to a cycle of pain and medication overuse. Each of these headaches has unique symptoms and causes, and understanding the differences between them is crucial. Are you feeling a constant dull ache around your head, or an intense throbbing pain on one side? Is the pain accompanied by other symptoms like a runny nose or sensitivity to light? Recognizing these signs can help you identify the type of headache you're experiencing. Understanding the type of headache you have is the first step towards finding relief. Now that we know the types of headaches and their causes, how can we prevent them? It all starts with understanding that prevention is a proactive process, not a reactive one. Let's dive into some practical steps you can take to prevent headaches from interrupting your daily life. For tension headaches, the most common type, it's essential to manage stress. Consider incorporating relaxation techniques into your routine, such as deep breathing exercises, yoga, or meditation. Regular physical activity is also important. A brisk 30-minute walk every day can do wonders for your overall health and significantly reduce the frequency of tension headaches. Moving on to migraines, these are often triggered by certain foods or drinks. If you're prone to migraines, keep a food diary to help identify potential triggers and avoid them. Some common culprits include aged cheese, alcohol, and caffeine. Sleep is also a key factor. Aim for a consistent sleep schedule with 7 to 9 hours of sleep each night. Cluster headaches, though less common, can be quite severe. To prevent them, avoid alcohol and nicotine, as these substances can often trigger an attack. Regular sleep patterns and a healthy diet can also play a significant role in prevention. Now let's talk about sinus headaches. These are often linked to sinus infections, so maintaining good sinus health is key. Regular use of a humidifier, especially during dry seasons, can help keep your sinuses moist and healthy. Avoid allergens, and if you're prone to allergies, consider taking an antihistamine. In all these cases, a healthy lifestyle is fundamental. Regular exercise, a balanced diet, adequate hydration, and proper sleep can drastically reduce the frequency and severity of headaches. But remember, everyone is unique. What works for one person may not work for another. So it's essential to listen to your body and find what works best for you. Prevention is always better than cure, but what if a headache strikes anyway? In the next segment, we'll explore various treatment options for when a headache does occur. Stay tuned. Finding relief from a headache can sometimes feel like a daunting task, but fear not, relief is within reach. When it comes to treating headaches, there are a plethora of options available. The trick, however, is finding the right treatment that works for you. This is because headaches can vary greatly in type, severity, and frequency, making it necessary to have a personalized treatment plan. Now let's delve into some common methods of alleviating headaches. On one hand, we have the non-drug approaches. These include applying a cold pack to your forehead, practicing relaxation techniques such as yoga and meditation, and ensuring you're getting enough sleep. Regular physical activity and maintaining a healthy diet can also play a pivotal role in headache prevention and treatment. And let's not forget about staying hydrated. Dehydration is a common trigger for headaches, so make sure to drink plenty of water throughout the day. On the other hand, we have the analgesic medications. These can be further divided into two categories: over-the-counter and prescription. Over-the-counter options include non-steroidal anti-inflammatory drugs such as ibuprofen and aspirin and acetaminophen, paracetamol. These are typically used for mild to moderate headaches. For more severe or persistent headaches, prescription medications may be necessary. These could range from triptans, used for migraines, to certain types of antidepressants or blood pressure medications, which can help prevent frequent headaches. Of course, it's important to note that medication should be used judiciously. Overuse can sometimes lead to what's known as rebound headaches, a vicious cycle where your headache treatments begin to trigger more headaches. Lastly, remember that everyone's experience with headaches is unique. What works for one person may not work for another. That's why it's recommended to work with a healthcare professional to create a treatment plan tailored to your specific needs and symptoms. Remember, it's always important to seek professional advice when it comes to health. Headaches, while common, should never be ignored, especially if they persist or worsen over time. Now let's discuss when it's time to seek professional help. If your headache feels different from what you're accustomed to, or if it's distinctly more severe, it's a good idea to consult a healthcare professional. In fact, any headache that's accompanied by confusion, trouble speaking, difficulty walking, or sudden severe pain should be promptly evaluated. When your headache is accompanied by fever, stiff neck, nausea, and vomiting, it could be a sign of something serious like meningitis. It's essential to seek medical attention immediately. Remember, a headache after a head injury, even a minor one, warrants a prompt medical evaluation. This could be an indication of a concussion or more serious brain injury. If your headache is accompanied by shortness of breath, racing heart, or any symptoms of stroke such as sudden numbness on one side of your body, seek emergency medical attention. These could be signs of a life-threatening condition. Frequent headaches that interfere with your life or don't respond to over-the-counter treatments should also be addressed with a healthcare professional. In essence, while headaches can be a common part of life, they can sometimes signal more serious underlying conditions. Don't dismiss persistent or severe headaches. Your health is your wealth, don't gamble with it. It's always best to err on the side of caution and seek professional help when dealing with headaches. We've covered a lot of ground today on the topic of headaches. From the very beginning, we dove into understanding what a headache truly is, and the reasons behind those nagging pains in your head. We explored the different types of headaches, each with their unique characteristics, causes, and effects on our bodies. We didn't just stop at identifying the problem, we ventured into solutions. We discussed various ways to prevent these types of headaches from plaguing your day-to-day life. Simple lifestyle changes, mindfulness techniques, and dietary adjustments can make a world of difference in managing these pesky pains. When prevention is not enough, we addressed various methods of treating headaches. We looked at options both with and without the use of analgesic medication, providing a holistic view of headache management. Lastly, we highlighted the importance of knowing when to seek further help. Not all headaches are benign, and some may signal a more serious underlying condition. It's important to know when to reach out to a healthcare professional. And with that, we've reached the end of our journey today. A big thank you to all of you for joining us in this exploration of headaches. If you found this video helpful, don't forget to subscribe to our channel, Vigor Vault. Give a thumbs up and share. Leave a comment telling us which tip you found most helpful, or suggest a topic for our next video. Remember, your health is in your hands.